RBC count. Your RBC count may become too high or too low if you have certain health conditions, including nutritional deficiencies, erythrocytosis, and some chronic health conditions. A red blood cell count is a blood test that your doctor uses to find out how many red blood cells (RBCs) you have. It's also known as an erythrocyte count. The test is important because RBCs contain hemoglobin, which carries oxygen to your body's tissues. The number of RBCs you have can affect how much oxygen your tissues receive. Your tissues need oxygen to function. Symptoms of an abnormal count. If your RBC count is too high or too low, you could experience symptoms and complications. If you have a low RBC count, symptoms could include fatigue, shortness of breath, dizziness, weakness, or lightheadedness, particularly when you change positions quickly, increased heart rate, headaches, pale skin. If you have a high RBC count, you could experience symptoms such as fatigue, shortness of breath, joint pain, tenderness in your palms or soles of your feet, itching skin, particularly after a shower or bath, sleep disturbance. If you experience these symptoms, your doctor can order an RBC count. Why do I need an RBC count? According to the Association for Clinical Biochemistry and Laboratory Medicine, the test is almost always part of a complete blood count, CBC. A CBC measures all components in the blood, including red blood cells, white blood cells, hemoglobin, hematocrit, platelets. Your hematocrit is the volume of red blood cells in your body. A hematocrit test measures the ratio of RBCs in your blood. Platelets are small cells that circulate in the blood and form blood clots that allow wounds to heal and prevent excessive bleeding. Your doctor may order the test if they suspect you have a condition that affects your RBCs or if you show symptoms of low blood oxygen. These could include bluish discoloration of the skin, confusion, irritability and restlessness, irregular breathing. A CBC will often be part of a routine physical exam. It can be an indicator of your overall health. It may also be performed before a surgery. If you have a diagnosed blood condition that may affect RBC count, or you're taking any medications that affect your RBCs, your doctor may order the test to monitor your condition or treatment. Doctors can use CBCs to monitor conditions like leukemia and infections of the blood. How is the RBC count performed? An RBC count is a simple blood test performed at your doctor's office. A healthcare professional will draw blood from your vein, usually on the inside of your elbow. They will then clean the puncture site with an antiseptic, wrap an elastic band around your upper arm to make your veins swell with blood, gently insert a needle into your vein, and collect the blood in an attached vial or tube. Remove the needle and elastic band from your arm. After collecting your blood sample, your doctor's office will send it to a laboratory for analysis. How should I prepare for an RBC count? There's typically no special preparation needed for this test, but you should tell your doctor if you're taking medications. These include any over-the-counter, OTC drugs, or supplements. Your doctor will be able to tell you about any other necessary precautions. What are the risks of getting an RBC count? As with any blood test, there's a risk of bleeding, bruising, or infection at the puncture site. You may feel moderate pain or a sharp pricking sensation when the needle enters your arm. What is the normal range for an RBC count? RBC ranges are measured in terms of cells per microliter. Now, normal ranges for RBC differ based on age and sex assigned at birth. Normal RBC range, million cells to coulels. Adult assigned female at birth, 4.2 to 5.4. Adult assigned male at birth, 4.7 to 6.1. Child, 1 to 18 years, 4.2 to 5.5. Infant, 6 to 12 months, 3.5, 5.2. Infant, 2 6 months, 3.5, 5.5. Infant, 2 to 8 weeks, 4.0, 6.0. Newborn, 4.85. These ranges may vary depending on the laboratory or doctor. Ranges may also differ for those who are pregnant. What does a lower than normal RBC count mean? If your number of RBCs is lower than normal, you have anemia. This can be caused by a decrease in RBC production or by the destruction or loss of RBCs. There are many possible causes for anemia. Nutritional deficiency. Iron deficiency anemia is the most common type of anemia, but lack of other nutrients can also cause your RBC count to decrease. These include copper, folate, vitamin B9, vitamin B6, vitamin B12. Bone marrow failure. In rare cases, your bone marrow might stop making new blood cells. This is called aplastic anemia. Aplastic anemia might be an autoimmune disorder. Certain drugs, viruses, toxins, or radiation may also cause aplastic anemia. Hemolysis. Hemolysis is the destruction of red blood cells. Common causes of hemolysis include autoimmune reaction to blood transfusion, infection, inherited conditions like sickle cell anemia. Chronic conditions. Underlying health conditions that cause inflammation may affect the way your body processes erythropoietin, EPO. EPO is a hormone that causes bone marrow to produce RBCs. EPO is produced in the kidneys. If you have chronic kidney disease, you might produce less EPO than normal. Other chronic conditions that may cause a low RBC count include, but are not limited to, autoimmune diseases like rheumatoid arthritis or lupus, infections like HIV or tuberculosis, cancers like leukemia or multiple myeloma, IBD, including Crohn's disease and ulcerative colitis. Other conditions. Other possible reasons for a lower than normal RBC count include internal or external bleeding, pregnancy, thyroid disorders. Medications. Certain drugs can also lower your RBC count, especially chemotherapy drugs, chloramphenicol, which treat bacterial infections, quinidine, which can treat irregular heartbeats, hydantoins, traditionally used to treat epilepsy and muscle spasms. What does a higher than normal RBC count mean? If your RBC count is higher than normal, you have erythrocytosis. This causes your blood to be thicker than normal and can increase your risk of blood clots. Primary erythrocytosis. Primary erythrocytosis is when your own body causes you to produce more RBCs. This is usually due to a problem with cells in your bone marrow. The condition is often inherited. One such condition is polycythemia vera, a bone marrow disease that causes overproduction of RBCs and is associated with a genetic mutation. Secondary erythrocytosis. Secondary erythrocytosis is when an external factor increases your RBC count. This could be due to a disease, drug, or another cause. Some medical conditions that can cause a high red blood cell count include congenital heart disease, respiratory disorders like COPD, pulmonary fibrosis, or sleep apnea, renal disorders such as cysts or kidney disease, certain tumors like renal cell carcinoma or hepatocellular carcinoma. Certain drugs can increase your RBC count, including gentamicin, an antibiotic used to treat bacterial infections in the blood, methyldopa, often used to treat high blood pressure, performance-enhancing drugs like anabolic steroids or protein injections, diuretics. Tell your doctor about any medications you take. Other potential reasons for an elevated RBC count include cigarette smoking, living at a higher altitude, dehydration, blood doping. Red blood cells and blood cancers. Blood cancers can affect the production and function of red blood cells. They can also result in unusual RBC levels. Each type of blood cancer has a unique impact on RBC count. The three main types of blood cancer are leukemia, which impairs the bone marrow's ability to produce platelets and red blood cells, lymphoma, which affects the white cells of the immune system, myeloma, which prevents normal production of antibodies. What if I have abnormal results? Your doctor will discuss any abnormal results with you. Depending on the results, they may need to order additional tests. These can include blood smears, where a film of your blood is examined under a microscope. Blood smears can help detect abnormalities in the blood cells, such as sickle cell anemia, white blood cell disorders such as leukemia, and blood-borne parasites like malaria. A bone marrow biopsy can show how the different cells of your blood are made within your bone marrow. Diagnostic tests such as ultrasounds or electrocardiograms can look for conditions affecting the kidneys or heart. Treatment for a low RBC count. All types of anemia require treatment. Your treatment will depend on what's causing your anemia. Iron deficiency. You can take iron supplements or receive iron infusions through your veins. Vitamin deficiency. You can take vitamin supplements. Bone marrow failure. Your doctor may prescribe certain medications. If medications don't help, you may need a bone marrow transplant. Chronic conditions. Your doctor will usually focus on treating the underlying condition. Sometimes they may prescribe an EPO-stimulating agent. Blood loss. A blood transfusion can bring in more RBCs to your body. Treatment for a high RBC count. If you have erythrocytosis, you may need a regular phlebotomy. This removes a small amount of blood from your body in order to lower your RBC count. If phlebotomies don't work, your doctor may prescribe hydroxyurea, Hydrea or Droxia, to reduce your RBC count. You may also need aspirin to help with potential blood clots. Lifestyle changes. Lifestyle changes can affect your RBC count. Some changes that can help increase your RBC count include maintaining a healthy diet and avoiding vitamin deficiencies, exercising regularly, which requires the body to use up more oxygen, avoiding aspirin, reducing alcohol consumption.